Moxibustion. As an external treatment, Moxibustion treats and prevents diseases by applying heat to points or certain locations on the human body with moxa wool or other kinds of herbs. This expels the evil and supports the healthy energy or warmth and regulates qi and blood by transmitting through the meridians. Just like acupuncture, Moxibustion was invented as a result of medical practices and life experiences of the Chinese people. Tracing back to ancient times, we find that even the branch of the mulberry or the seedlings of the peach tree were used in Moxibustion treatments. Nowadays, the most commonly used material is moxa wool, which is made from artemisia leaf. It is capable of dredging the channel passage, expelling the cold and dampness, and recuperating the depleted yang to protect the patient from illnesses. Moxa wool can be made by processing the fresh artemisia leaf. Because of different production processes, moxa wool can be divided into thin and thick. The moxa wool, which is lithe and fluffy, is always considered high quality, while a hard or loose one suggests the opposite, and often causes scalding of the skin when it is used. Generally, old moxa wools function better than the new ones. Moxa wool should be preserved in a dry container. Commonly used Moxibustion treatments are as follows: Moxibustion with moxa cones, Moxibustion with moxa sticks, Moxibustion with warming needle, Moxibustion with mild Moxibustioner, crude herb Moxibustion, burning rush Moxibustion. At the very outset, we would like to introduce Moxibustion therapies with moxa cones. The moxa cone is cone-shaped, and when a moxa cone expires, we say that we have finished one unit. In clinical application, the operator can increase or reduce the degree of stimulation by adjusting the size of the moxa cone. A moxa cone is made by hand kneading the moxa wool or pressing them with a special instrument. The smallest is the size of a grain of wheat, and the largest the size of the upper part of the thumb. Moxibustion with moxa cones can be direct or indirect. Placing a moxa cone directly on the point to be ignited is called direct Moxibustion or open Moxibustion. Prior to Moxibustion, relax the patient and make him comfortable by proper body aligning and positioning and applying some Vaseline or garlic juice to the site to increase the adhesion of the moxa cone on the skin. Then put the moxa cone on the point and ignite it. When the patient feels a burning sensation, replace the cone with a new one. The local skin should turn red instead of showing any blister. This method is called non-scarring Moxibustion. Indications are diseases of deficient and cold nature. A cotton ball and a medicated adhesive strip should be prepared before festering Moxibustion. Festering Moxibustion is administered by putting the cone on the point and igniting it until it completely expires, and patting the local region around the point when the cone is about to burn the skin in order to release pain. Wipe the local region with a cold gauze after a Moxicone expires and then put on another one. Repeat the procedure several times, then stick the medicated adhesive strip on the points. Change the strip every day, and after a few days, a non-bacteria festering reaction will appear. A scar will form in about a month. Therefore, the festering moxibustion is also called scarring moxibustion. During the festering period, patients are advised to adopt a nutritious diet, rest, and keep the local region clean to avoid infection, or dress the moxibustion area till the scar is formed. This is suitable for the patient who is weak or suffering from certain chronic diseases, such as asthma or gastroenteritis. The wheat grain moxibustion is often more acceptable for the patients. The moxicone used in this method is made in the size of a grain of wheat. Indications are diseases of deficiency of qi and blood, dizziness, or common warts. Indirect moxibustion can be further divided into several types according to the material placed between the moxicone and the skin. Moxibustion with ginger. Cut a slice of ginger about ½ centimeter thick. Punch a number of holes in it and place it on the point selected. On top of it, a moxicone is placed and ignited. This method is indicated for symptoms caused by weakness and yang deficiency, such as diarrhea, abdominal pain, and painful joints. When the patient feels a scorching sensation, put a piece of paper between the ginger and skin, then continue the treatment until the local skin turns red. Moxibustion with garlic. Cut a slice of garlic. A larger single clove of garlic is desirable. Put it on the point with the ignited moxicone above. This method is indicated for scrofula, tuberculosis, early-stage skin ulcer, etc. Besides the method mentioned above, there is another moxibustion method with garlic, which is called spreading moxibustion, or long snake moxibustion. Use 500 grams of pared mashed garlic. The mashed garlic should be as fine and smooth as creams. While operating, adopt the prone posture. Expose the patient's back and make him comfortable and relaxed so that the patient can endure the moxibustion. Dress the mashed garlic from the point Da Zui, do 14, to Yao Shu, do 2 on the spine, about ½ centimeter thick and 5 centimeters wide. Fix the mashed layer with the cotton surrounding it, then put the moxicone from Da Zui, do 14, to Yao Shu, do 2, and ignite. Do not stop the moxibustion treatment until the patient smells the garlic in his mouth and nose. This method is indicated in consumptive disease or stagnation syndrome of vital energy and blood. Moxibustion with salt is usually applied to the umbilicus. Fill the umbilicus with salt to the skin level. Place a moxicone on top of the salt and then ignite it. One can also put a slice of ginger between the salt and moxicone. This method is effective in cases of acute abdominal pain, vomiting, diarrhea, syncope, and collapses. Place a coin full-size Moxhood cake between skin and moxicone during the Moxibustion treatment. This is called Moxibustion with Moxhood. It helps to warm the kidneys and strengthen yang. Moxibustion with pepper. Make a pepper cake of about 1/4 of a centimeter thick by mixing pepper powder with wheat powder. The middle of the cake should be concave in shape and be filled with clove and the powder of Chinese cassia tree bark. Place it on the site for Moxibustion with the moxicone ignited and burning on the top. It is suitable for treating wind, cold, wetness types of arthralgia and numbness of the local region. Moxibustion with loess is administered by kneading the loess into a cake. Punch a number of holes in it. Place it on the wart with the ignited moxicone burning on it. This method is good for dispersing the common wart and treating eczema. Moxibustion with yellow wax. Cover the swollen area with wet wheat powder about 2½ centimeters high. Wrap a piece of cloth on the outside, while the inside is filled with wax crumbs of about 0.75 to 1 centimeter thick. Use a copper spoon with charcoal burning in it and heat the wax until it melts. After the wax solidifies, refill and repeat the procedure till it is fully filled. Having done all the steps above, spray some cold water on the wax and then take them off the skin. This method is suitable for common warts and arthritis. Because of its distinct therapeutic effect, Moxibustion with Moxa sticks is often used today. A Moxa stick mixed with herbs is called herb Moxa stick. Otherwise, it is called a non-herb Moxa stick. Lukewarm Moxibustion is administered by applying an ignited Moxa stick over the point, about 1¼ to 2½ centimeters, to bring a mild warmth to the local area for 3 to 5 minutes until the local area is reddened. While sparrow pecking Moxibustion is applied, the ignited Moxa stick is rapidly tapped over the point, like a bird pecking grain. Administering the ignited Moxa stick in a circular movement over the point is called circle Moxibustion. Herb Moxa stick can be divided into 2 types, the Great Monad Herbal Moxa stick and Thunder Fire Herbal Moxa stick. Composition of the Great Monad Herbal Moxa stick are as follows: 2,000 grams of moxa leaf, 500 grams of pepper tree prickly ash, 90 grams of sheep's blood, a little musk, 500 grams of common myrrh tree, 500 grams of olivinum, 500 grams of common fennel, 250 grams of pangolin scale, 125 grams of ginseng, 1,000 grams of licorice root, 250 grams of pseudo-ginseng root, 500 grams of jian, 500 grams of jiandifang, 500 grams of Chinese cassia tree bark, and 500 grams of Chinese atractolauds, 2,000 grams of fangfang. Compound these herbs together and grind into fine powders. Put some powders on a piece of paper and tightly roll them together. Then paste the outside with several pieces of mulberry paper. Dry the stick in a cool place away from sunshine before use. Compositions of Thunder Fire herbal moxa stick are 100 grams of moxa wool, 15 grams of agalak eaglewood, 15 grams of capillary artemisia, 15 grams of mushion, 15 grams of olivinum, 15 grams of notaptergium, 15 grams of pangolin scale, 15 grams of dried ginger. These herbs are compounded and ground into fine powders. Make the stick by following the procedure mentioned above. When operating, ignite the stick with an alcohol lamp and wrap with several pieces of cloth. Then place it on the selected point or the affected part. Repeat treatment 5 to 7 times. The method is used for arthralgia caused by wind, cold, and dampness. Don't forget to put the stick into a glass bottle, otherwise the stick will burn again. Moxibustion with a warm needle is used for conditions in which both the retaining of the needle and moxibustion are needed. After the arrival of Qi and with the needle retained on the point, wrap the needle handle with a unit of moxa wool and ignite it until the unit burns out. Then wrap on another unit. After 3 to 5 units have been administered, stop the treatment. There are some points for the operator to be aware of when wrapping the needle handle with a unit of moxa wool. First, knead the moxa wool tightly and make into a cake with the index finger, ring finger, and thumb. Then lean the cake against the needle handle and wrap the cake around the needle handle with the help of the fingers. Press and twist with force and make the moxa wool unit shape as an olive pit. There are various kinds of moxibustion instruments. Usually, there are small holes in the bottom and a tube inside which can be filled with moxa wool and herbs. The ignited instrument can be moved from left to right upon the selected area or the point till the local skin turns red. There is another kind of moxibustion instrument which is equipped with asbestos and can be filled with moxa wool or a special moxibustion stick. This instrument can be secured on the point or the affected area while operating. Crude herb moxibustion is also known as automatic or cold moxibustion. Materials used for crude herb moxibustion are garlic, malgum, blister beetle, yerba de tajo, and white mustard seed. Which one to choose depends on the different conditions of the patient. Mash the herb of your choice and dress it on the point. The stimulating effect will congest the local skin and blister and scars will be formed later. Thereby, the therapeutic effect is achieved. Moxibustion with a stem or rush, a kind of medical herbs in Zhejiang province, is considered the first choice for pediatric patients. Dip a stem of rush into oil, then take it out and burn it on the affected area or selected points of the child's body. method is suitable for infant convulsion, coma, and cramps. Moxibustion with the needle tail is done by heating the tail of a pin and operating on certain points of the patient's body. Moxibustion with a yang shui stick. Stick a medicated paper on the patient's body and then operate on top of the paper with a special kind of Moxibustion pen. The indications are live. Each of the Moxibustion methods has its own distinguishing feature. What to use clinically depends on the different pathological conditions of the patient. Moxibustion is generally applied earlier to the yang portion than the yin portion. Treat the upper part first and the lower part second. The head and body first and the four extremities second. Reinforcing and reducing methods can be adopted if necessary. Simmer and let the moxicone burn out itself, then wipe off the ash and press the point. This is called reinforcing. Reducing is achieved by puffing the ignited moxicone, quickening the burning speed, and opening the point as well as in order to disperse evil. Generally, indications for moxibustion are mostly the syndromes of deficiency, cold, and yin syndromes. But patients who suffer from deficiency of yin and hyperactivity of yang or evil heat domination cannot use moxibustion. For strong male patients and patients with excess syndrome or the area where the muscle is thick, we should apply large cones and more than 3 units. For patients who are weak or suffering from deficiency syndromes or chronic diseases, the small cone should be used and fewer units should be applied. Direct or scarring moxibustion should not be applied to the face and head, the vicinity of large blood vessels, the cardiac apex region, pudenda, tendons, or joints. Otherwise, it may affect their function. The abdominal and lumbar regions of pregnant women are not allowed to use moxibustion in order to avoid miscarriage. To prevent serious accidents, the vertex of infants is also not for moxibustion. It is normal if a slight redness appears on the skin after moxibustion. But sometimes a few blisters result on the skin surface. Take care not to let small blisters break. They can heal by themselves. Large blisters should be punctured, drained, and dressed to prevent infection. If the fester turns yellow or green, or even oozes after festering moxibustion, then an antiphlogistic can be applied. Moxibustion has a history of 2,000 years. The theories had been systematically established and clinically tested long ago. Long periods of clinical practices have proven that moxibustion functions well in warming the channel and expelling cold. Promoting blood circulation to remove blood stasis. Recuperating the depleted yang. Supplementing vitality and keeping patients free of diseases. In order to develop the traditional therapeutic method, we are making efforts to sum up the experiences in clinical application. When using white mustard seed as a material, put between the skin and moxicone. It is effective for asthma in children and has the function of warming the lungs, eliminating sputum, and relieving wheezing and cough. Using moxibustion on Zusan Li, stomach 36, and Da Zui, Du 14, can stir vital energy of the human body and enhance ability to resist diseases. Direct moxibustion in experiments greatly improves the immunity of the mouse inoculated with cancer cells to resist cancer. While used in the human body, it can also improve patients' health. Numerous facts show that moxibustion can regulate the physiology function and improve the ability of resisting disease. Considerable effect has been made in treating hypertension and hepatitis B. In ancient times, people did moxibustion by focusing the sunlight. Now, moxibustion with infrared rays is used instead of sunlight. Besides the methods already mentioned, there are also some other methods, such as moxibustion with argon or ion laser, which has greatly improved the effect of moxibustion therapy. With the development of modern science, we are sure that further study of traditional moxibustion therapy will help uncover the mysterious world of the human body. Cupping method. In ancient China, The cupping method was called the horn method. This is the horn cup used in the cupping method. And this is the ceramic cup, which was used in ancient times. There are various kinds of jars used on the body, but the commonly used are as follows: glass cups, bamboo jars, and even a copper or steel cup. The cupping method can be divided into fire cupping, water cupping, and air pumping cupping. Fire cupping is most commonly used nowadays, and it includes several manipulating methods. The fire throwing method. Throw a piece of ignited paper into the cup, then rapidly attach the mouth of the cup firmly to the skin on the desired location. Fire twinkling method. Clamp a cotton ball or a piece of paper with forceps. Ignite it and put it into the cup, and immediately take it out and place the cup on the selected position. Sticking cotton ball method. Stick an alcohol cotton ball smeared with Vaseline on the inside wall of the cup, ignite it, and place it on the selected area. Fire propping method. Place a non-combustible or heat-resistant material about 2 to 3 centimeters in diameter on the selected area with an alcohol cotton ball on top. Ignite the cotton ball and cover the cup over the area. A strong suction can be produced with this method. Alcohol dripping method. Put 1 to 3 drops of 95% alcohol or white spirits into the cup. Shake the cup and make the alcohol adhere evenly to the inside wall of the cup, then ignite it and cover the cup swiftly over the desired area. Generally, a bamboo jar is used when the water cupping method is applied. Put the bamboo jar in water, heat, and bring to a boil. Then take it out with forceps, whip the water out, or cover the mouth of the jar tightly with a hot towel. Place the jar on the skin, and it will stick there. If herbs such as Notaptergium, angelica, Chinese angelica, safflower, monkshood, or Kuznetsov monkshood, which help to promote blood circulation and expel wind evil, are put into the water, then we call it herb cupping. It is used in treating wind, cold, wetness types of arthralgia. A so-called air drawing cup is used in air pumping cupping method. It is a special cup with a piston on top, or it can be made by taking out the bottom of a penicillin bottle. Extract the air in the cup and place it on the skin, and the cup will adhere to the area. The advantage of the air drawing cup is that we can control the suction conveniently. Generally, when the skin becomes congested with violet-colored blood stasis formation, we should take the cup off. Besides the manipulating methods mentioned above, there are also other kinds of clinical applications for the operator to be aware of. A single cup is applied when the affected area is small or tenderness point is relatively confined. Several cups can be applied if the area is broad, for example the back, lumbar, and buttock regions or shoulders. When several cups are applied, notice that the cups should be lined orderly and a moderate distance should be left between cups. Quick moving cupping method. As soon as the cup is sucked in place, take the cup off quickly and place it onto the place again. Repeat the procedure several times till a red spot appears on the local skin. This method is suitable for numbness of local skin and body function disorders. Retaining of the cup. While operating, leave the cup on the area for 5 to 15 minutes. If the cup is big or with strong suction, the time of retaining is better reduced. Likewise, if the method is applied to the area where muscle is thin or when it is summertime, the duration of retaining should also be shortened. Walking cupping method, also known as pushing cupping method. The mouth of the cup requires smoothness and usually a glass cup is desirable. Smear the glass mouth with lubrication oil and when the cup is sucked in place, hold it and put stress mainly on the posterior part of the cup, then push back and forth, left and right several times until the skin turns red. But remember not to do the pushing method at the area where bones stick out. Otherwise, it may scratch the skin or result in the leaking of air and the cup will fall off the skin. This method should be applied to the back or lumbar region where muscles are thick. When cupping is combined with acupuncture, it is called acupuncture cupping method. After the needle is inserted, place the cup on the area for the needle. Note that any condition that leads to muscle spasms should be avoided in order to prevent the needle from bending, and the needle should in no case be impacted. Otherwise, it may result in serious injury. Cupping combined with bloodletting techniques. First, prick a small vein with a triangular needle or subcutaneous needle. Follows. Indications for this method are acute or chronic injury of the tissue, neurodermatitis, Qing inflammatory disease with redness of the skin, and neurasthenia. For adults, bleeding is best controlled within 10 milliliters. Rheumatics, abdominal pain, gastralgia, dyspepsia, headache, hypertension, the common cold, cough, pain in the back or lumbar region, menstrual pain, venomous snake bites, and dermatosis. It is not advisable to apply cupping to the skin where bones are prominent or where the skin is hairy. To withdraw the cup, press the skin with one hand and hold the cup with the other. When the air leaks out, take the cup off gently. Notice that forceful pulling or twisting should not be applied. After withdrawal, if the punctured hole is still bleeding, remove the blood with a dry cotton ball. After cupping, there is blood blood stasis or bruise at the local area. They generally disappear several days later. Because of its distinctive clinical effect, the cupping method, the traditional Chinese therapy, is widely used in China as well as in foreign countries.